Now, ladies and gentlemen, what we're going to do now, between now and concluding at 5 o'clock, is that we have a panel with audience participation. You've already seen my keen desire for questions or comments from the audience. And we're seeking to focus on making it happen for people like Joan from our presentation from the United States. So we are looking at one or two most significant systemic barriers to Joan fulfilling her wishes and having autonomy, and how we overcome them. And I guess I really want to ask our panel to focus on examples of collaboration that show us the way forward. Who should be collaborating with whom in order to make Joan's life the best possible life possible? I mean, that's the nub of it, isn't it? Just before I go to that, though, because I don't want to forget, is I'm going to ask Prue to come forward. Do you mind coming out, Prue? Prue Gregory is from Know More, KNOW, a community legal centre, and you're the principal solicitor there. So tell us about Know More. What's it about?
So Know More is a legal service set up by the Royal Commission into institutional responses to child sexual abuse, and we've just received funding to be the legal service to help people do their National Redress Scheme applications.
So how does your work offer insight into what we're trying to achieve here? What are you doing that we need to do more of in the health and legal sector?
Right, so I'm actually the flip of what we've been talking about today. My service is a service which includes in the mix social workers and counsellors, financial counsellors and Aboriginal Torres Strait Islander workers, and lawyers. So we actually have people coming to us. It's not in a hospital setting. People come to us with a legal problem, and we realise that as lawyers we need to work with social workers and counsellors and financial counsellors and Aboriginal workers as well.
And do you work with allied health or actually health trained staff?
We don't have allied health as part of our service, but what we have found is nearly 25% of our clients have only 6 to 12 months to live, and we have developed really good relationships with palliative care specialists throughout Australia.
So what lessons have you learnt about effectively getting health and law to collaborate so that it's good for the person?
I think it's been really important that the professionals ebb and flow around the person. So you actually work with a person, and rather than have silos or egos, that you each work together at the time that the client might need a lawyer, but then the client becomes elevated or escalated in my case, and I can't take instructions from them, and it's really important that I work with a social worker to bring that person, to ground them into 2019, so I can take instructions. So it's a case of no silos and no egos, but ebb and flow with the service providers.
But Prue, the whole world is ego and silos. No, I'm not having a go at anyone. We just know that to be so. So how do you actually achieve that reduction of the role of egos, the reduction of the barriers between organisations?
For us, it's been relatively straightforward because our clients are so unwell with depression, anxiety and everything else to do with the mental health system. It was really absolutely paramount that we work together pretty damn quickly.
Is there anything else you'd like to offer as a lesson you've learnt to guide us going forward? I mean, all these people do seem keen to collaborate and make a difference. So any tips?
It works. It really works. And so while I've been fascinated to hear about what's happening in the hospital setting, I think in the community setting as well, these partnerships should be being put into place.
Well, thank you so much. Would you give her a round of applause, please? The first person on the panel I'd like to come to is Faith Hawthorne. Can you explain, Faith? Now, guys, close to your mouth, and you put the microphone like that to get maximum volume and speak loud. Can you introduce yourself, Faith?
Hello. Can everyone hear me okay?
Yeah, that's great.
Great. So my name is Faith. I feel very powerful because I actually have my own microphone, so I feel very, very privileged. Thank you all for coming along. It's really great to be here to talk about these really important issues. So I work at Justice Connect. I work with Yvonne, but I'm based down in Melbourne. We have a rich history, 10 years history, working with health and community organisations and older people to address legal need. I suppose I wanted to share a few reflections on Liz's presentation. So a lot of things that you spoke about is really consistent with a lot of the work that we're doing in Melbourne.
Could I just give a straight intro on you just before you do that, and that'd be fantastic. So Faith is a manager and principal lawyer in the Seniors Law Program in Justice Connect, which is a community legal centre. And they have justice health partnerships with CoHealth, Caulfield Hospital, St Vincent's Melbourne, and also discrete projects. So she's deeply involved in what we were talking about when we met our friends from St Vincent's in Sydney. So sorry, reflections would be great. Thank you.
Sure. So I think the first reflection is that trust is really key. That interprofessional trust is the best place to start. Workers have to trust our lawyers, and older people need to trust our lawyers. So without that, we don't really get anywhere. The second point, or the second reflection, is that early intervention really is key. And we found that if we can intervene early, if we can help identify these really subtle legal issues early, we have a much better chance of getting better legal and health outcomes for people. And in Victoria, we found that we have better outcomes really, really good outcomes in community health because there are workers there. Like I work with a nurse who's been working at CoHealth for 20 plus years. So she knows older people, she knows their families, and really importantly, she knows how to identify illegal issues. So that's probably the second reflection.
Could I just ask what CoHealth is?
So CoHealth is a community health organisation. They operate out in the northern and western suburbs of Melbourne. The reason why we partnered with them is because they see a lot of the priority groups that we want to be able to see. So there's probably 4 groups that we want to work with. The first one is older people at risk of or experiencing elder abuse, people who identify as coming from a particular called communities, people who are ageing alone, and also we have discrete projects with various LGBTI organisations because we know that a lot of older people in the LGBTI communities, their rights are really overlooked.
And CALD is our latest acronym for multicultural. Just so to explain the lingo. So can you tell us what you actually do at Caulfield Hospital, St Vincent's and CoHealth? Give us a sense of how you benefit people.
Would it be useful for me to use an example of what a sort of early intervention would look like? I think that's the easiest way for me to talk about our work. So I can give you 2 very brief stories. One story was clients. I heard about the case even before I started at Justice Connect. This is an example of, I think, lawyers getting in too late. We had an older couple in their 80s. They found themselves living in their car that they would have to park in their friend's garage. Their son had kicked them out of their home because they'd sold their property. They'd given him some money. He said, "I'll care for you." They moved in with him and it just didn't work out. And so he said, "You have to leave." So they found themselves living in their friend's carport. We obviously helped them provide housing immediately, but then it took us about 3 years to negotiate with the son around the provision of money back to his parents. So it ended up going off to court. The mum in her 90s ended up having to go into the witness stand and have to provide evidence. She was cross-examined by her son's lawyers for a couple of days around conversations that she'd had with her son years and years ago. In the end, after all of that, we got a 6-figure payout for her and her husband. But, I mean, so you could say, oh, it's a legal win, but actually we never, ever, ever want to see clients in that situation. It was a terrible experience for them. So what we aspire to do is we aspire to reframe what role lawyers play in keeping people out of court so they don't have to go off and engage with this legal system. So an example of a client that we saw just last year, a couple, they were in their 50s, they bought their first home, they were really excited. The bank said to them, you have to put your son on title, which they did a bit reluctantly. It transpired a couple of months later, the son had a really bad drug problem and it had accrued a significant amount of debt. Now, fortunately, his creditors hadn't started knocking at their door, but it's kind of inevitable. And most people would kind of say, well, you don't really get lawyers involved until the sheriff's knocking on your door or you're starting court proceedings. But fortunately, our counsellor at CoHealth knew differently, and she was able to just flick us through an email. So we met with the clients, we engaged a barrister, we engaged a lawyer, and we helped them draft up some very, very simple legal documents. A very exciting, sexy thing called a caveat and a deed. Now, it's not as exciting as going off to court, but I would be so happy, I'd be overjoyed if my entire day was spent filling out deeds and caveats for clients rather than sending off to court. So that for me is an example of really good early intervention and something that we couldn't have achieved without being in a health justice partnership.
And so there's the term I think Liz used, and I might not have it quite right, was the idea of a medical medical legal checkup. What was the expression you?
A legal checkup as part of, yes.
So the notion of a legal checkup. So what are the barriers to that happening early in the lives of older people that we need to overcome? Because we've been asked to identify systemic causes of vulnerability. What are the one or two key things? What would you say? Because obviously a legal checkup in your 50s is a great idea, isn't it?
Yeah, absolutely. I think we need to redefine what lawyers and other trusted advisors can do for older people. I think we need to rethink that you don't just involve lawyers when you're about to go to court. There is a real role for trusted advisors to provide that initial advice. I mean, one example of how we identified a systemic issue is the work that we did with the LGBTI community. They already face high levels of disadvantage. They fear discrimination by service providers. They also fear family conflict, so conflict between their biological family and their family of choice. So what we did was we prepared a resource for them on end-of-life planning. It's called Safeguarding the End of the Rainbow. And what that does is it really outlines what their legal rights are and some really, really simple ways so for example, through supportive attorneys where they can make sure that the right person is involved in decision making and the right decisions are being made. Even though we were able to develop that resource, we've still identified that there are real gaps in laws and systems for groups experiencing disadvantage, so either people who are ageing alone, who don't have someone to appoint as an attorney or an executor, and that disproportionately impacts on people in the LGBTI community. So you can have outcomes at an individual level, but we also need to have time to look at these systemic issues.
Faith, just one quick question, I'll move on. Your organisation is collaborating at 3 locations. So how did you get those collaborations up and running? Because I think it's fair to say the organisers of this today want you to all go forth and collaborate. So what did you do?
So we started working with these health partners, most of them, so Caulfield in particular and CoHealth. We started working with them 10 years ago. We set up outreach clinics there where our pro bono lawyers would go out to the clinics and train staff and be there to provide assistance. What we found though was that doing that, a lawyer going out sort of half a day or one day every month wasn't really enough to meet the needs of older people. What we've found and what our evaluation has since told us is that people need to be out there pretty much every week. So we have lawyers out 2 to 3 days per week. At regular sites every week to provide that initial assistance, to provide that really intensive triage with these matters. So we found that just sending people out ad hoc every now and then isn't enough. It's that ongoing physical presence that's really necessary.
Thank you so much. Can you give her the clap of encouragement? I'll just take this. What I'm going to do is go to 2 or 3 people and then offer questions or comments and then go to some more. So hold on. If you have an urgent need to ask a question or make a comment, just wave in my direction. But I'd like to introduce now Marianne Geronimo, who's a Senior Policy and Project Officer with the Federation of Ethnic Communities Councils. Now, we've talked about a very nitty-gritty, hands-on health justice sequence of partnerships, but you've been involved in a sort of higher level diversity framework and action plans. Can you tell us what you've been up to?
Yes, so
The aged care diversity framework has been developed over the last 2 years and was recently launched earlier this year. It was really to figure out how all these barriers for older persons who are in these diverse groups, including the LGBTQI, the culturally and linguistically diverse communities, and the ADSI, to figure out how each stakeholder would be able to respond to the outcomes that's supposed to be happening for all these groups of communities.
And so who did you collaborate with to develop the framework, and then how are you going to implement it?
So for the CALD community in particular, there were a series of consultations with aged care providers, with other peak bodies working with older persons who are of CALD background, as well as the CALD older persons themselves. So these series of consultations was really to find out and figure out what could be the actions that can be identified to address the barriers.
And can you give us a sense of one or two of the key barriers and two or three of the key actions, just to give us a flavour of your work?
So one of the things that they're looking at as an outcome, and it's a barrier as well, is making informed choices. So for the CALD community in particular, language is a very crucial issue. And in so many cases, many shall we say, policies or even forms at the where the older person would be transacting with the health sector, for example, are not translated into their own language, and there are a lack of people who are knowledgeable about helping them translate or even interpret what these rules or what payment systems or what they are in fact eligible for. So this difficulty navigating the system really is making older persons in CALD communities be isolated. They would rather not be a problem with their children, asking for help or asking help from the community because of this very simple problem which can be addressed in fact.
And so what are the sort of initiatives or actions that you're seeking to promote in the framework? Because they are such significant barriers, aren't they?
Yes.
I mean, even I have a law degree and I still found negotiating aged care issues with my mother really a challenge intellectually.
Yes. So one of the practical solutions that has been rolled out recently was the Aged Care Navigator System trials. So this is, in fact, to help set up some models in the community where older persons will be helped as they go through the system, the health system. And so we have CALD service providers in the different states develop their own models, and we are trying to study which models can be very effective in terms of really making it simple for the CALD older person to go through the system.
And has that already begun, those trials?
Yes, it has been launched in February, and it's now being implemented.
Is there another example of an initiative you can share with us?
So there are other networks on the ground. We have service providers that are very CALD-specific, or shall we say, ethno-specific, provides ethno-specific services. So these are responses that are really important, but at the moment, many of them are in, shall we say, in a difficult position because of the streamlining of the healthcare aged care system. There might be out of business in a sense because many of them are very small. So these types of businesses, in fact, responds to, shall we say, niche market. And so there has got to be support for them because at the moment, even for navigating the system, doing translations, or even making the families understand what's happening on the changes with the system is being done by them without any extra cost to the system.
I'm trying to understand fully what you're saying, Marianne. So you're saying that the system is driving, as it were, more and more large organisations being dominant, and that disadvantages various ethnic communities because you need smaller community organisations with people who speak the language and know their community, and they may not get government funding. Is that the issue?
Yes, so primarily this is because of of course, the current problem is that we have to streamline quality. We have to know what's happening, and there are, a lot of, shall we say, guidelines on how to meet that. Small organizations like these need to be helped, need to be provided support so that they would be able to, meet the requirements, the quality requirements of the sector.
I feel like the spirit of this day is collaboration going forward, and I'm not sure if you, Marianne, or anyone else in the room can give me some help, like how can that challenge that we've just heard be met in the context of collaboration? Because, how will that be resolved so that the, communities that may not have very significant numbers in Australia can still have informed access to services with people who understand their cultural and language needs? I mean, that's what we're looking for, isn't it?
Yes, one of the things that these providers have been looking at, and they are part of the consortium of FECA, is that they can have partnerships with bigger organizations to look at specific, ethno-specific clients. And this should be welcomed. And we are also looking at the possibility of not just recommending culture-related training. At the moment, these are just recommendations, but we feel that this should be a requirement throughout the aged care system because of the diversity of, the older population.
So just finally, for the range of people who are in this room, what support does FECA want from mainstream services to enable your communities to have the empowerment and access to health and justice that we're talking about?
Well, one of the things that we understand is that there is recognition for diversity, but there is really that low understanding of how to put that into practice. So the Aged Care Diversity Framework and Action Plan that was created is very specific in a sense that it identifies you, if you are in government, what would you do to help older persons of CALD background, LGBTI background, or ATSI background, how to help them make informed choices. So if you are the service provider, how would you do that? So this is a guide that needs to be out there, that needs to be used. So in terms of collaboration, this is really about everybody working together and learning more about this particular group.
So you've got a link, I know, to that report, and I'm just wondering if Tessa and the others, we can circulate that through your emails so that you can have access to it. Can I just ask, is there any question or comment in relation to what Marianne has said or Faith has said? Just if anyone's thinking of something. Thank you. Can you introduce yourself?
Thank you. I'm Anne McGowan from Protecting Seniors Wealth. A lot of comments I've heard from lawyers or advisors who we work with is that the laws don't protect the elderly. And so I'm wondering, does anyone here have any input or any awareness about new laws that may be in the pipeline to help older people?
So the question is more law reform needed, I think. Do you want to comment on that, or will I go back to our learned friend from... Do you want to just whip the microphone down? I mean, I can take it from other people, but your quick thoughts? Are the laws adequate that we have?
I suppose it depends on the particular issue. Sorry, I'm being a lawyer. I'm saying it depends. Terrible habit. I'm sorry. I also will say that I'm based in Victoria, so a lot of the laws that I'm talking about are Victorian, so they don't necessarily apply in different states. What's happened recently, which is probably over the last couple of years, is around decision-making frameworks. So there seems to be a move away from this idea of acting in the best interest of older people to a more nuanced approach around placing older people at the centre of decision-making. So saying you should be able to make decisions as much as possible and for as long as possible. So I think these changes are a good thing. So we've seen it in the Powers of Attorney Act. We're now seeing it coming through in guardianship and administration laws in Victoria. The issue, though, is that a lot of these changes or these new rights that are being provided don't really work for particular cohorts that already experience quite a bit of disadvantage. So a lot of older people, if you don't have an attorney, then a lot of these rights that are coming through and these new laws, you can't really avail yourself of them. So that's quite problematic.
So it might be access to them rather than the law itself. Could I come to Associate Professor Nola Rees from University of Technology Law School? Your thoughts on that?
Yeah, so from a New South Wales perspective, the Guardianship Act was recently reviewed by the State Law Reform Commission, and there is a recommendation for New South Wales to have a legal framework similar to what Victoria has moved to. So moving away from this model of guardianship where others step in and become a guardian for someone with cognitive impairment and make decisions for them, shifting more to the supported decision-making model that Teresa described. I think that's a really important shift in the law. But likewise, there's often a gap between the legal framework and what happens in practice. And around aged care regulation, we increasingly hear stories of regulations just not being enforced.
Can I ask you just I've got one more question and then I'll come back to you again if I may. Do you want to introduce yourself?
All right, sure. Oh, sorry. I was forgetting I'm not allowed to control the microphone. My name's Margaret Duckett. I'm Board Chair of Seniors' Rights Service. I'm actually wanting to raise an individual case study of my mother. For 5 years, I was primary carer of her aged 91 to 96. She was very, very clear that she wanted to live at home by herself independently in the family home, despite having total short-term memory loss. Every time we went near a health service provider, they wanted to put her into residential care. I've had to fight a couple of times each year really, really significantly, despite having medical power of attorney, despite Ruth always being really clear that her informed choice was she wanted to live at home. And to me, that whole issue of autonomy and respecting client decisions is paid lip service to, but doesn't actually happen in reality. The service providers universally saw they were doing the right thing. It would be safer for my mother to be in residential care. I was able to quote chapter and verse on the statistics of life expectancy once you go into residential care, the much higher risk factor of actually being in a residential care than a nice clean home with a whole lot of support. But that kept being ignored. And
what's your analysis of it? What was the is it cultural? What's your analysis of the problem?
I think it's ageism and I think it's cultural. I think we need the International Convention on the Human Rights of Older People to be ratified, to be passed by the UN, and for Australia to ratify it. That's coming up at the UN Working Group on Ageing in April in New York. I think we need I want Australia to ratify that, but in the interim, if it takes a bit longer, I want Australia to have a similar legislation. And I want education about the rights of older people. To me, we wouldn't be having the Royal Commission into Aged Care showing all the problems if there was an acknowledgement of the human rights of older people. And I keep coming back to the fact there's lip service paid to it, but it's rampant ageism throughout the entire society. And I think every interaction I've had on behalf of older people or about older people, ageism keeps coming into play.
And how would you explain to a Year 12 student of reasonable capacity what ageism is?
Treating an older person as a lesser person, that they're disposable people. It's quite right for the grandchild to have the money from the estate now because they desperately need it for their house. And the older person, she has had a whole full life. They don't need a whole house to themselves. They can have a little room.
Can I come to you? Thank you so much. Do you want to give her a clap, please? Can I ask you, Nola, to respond? This is obviously all close to your heart. Your response to that. And I'll come to you, Kay.
Yeah.
Kay's desperate. Well, we'll go to Kay first because she's desperate.
Yeah, I would just applaud, and that's what I have to say to that. Thank you.
Thank you. I'll just introduce Kay, who's desperate. I like desperateness in a panel member. The Honourable Kay Patterson is the Age Discrimination Commissioner, and I had a number of things to ask you, but what are you desperate to say? Nice and close to your mouth.
I'm desperate to say that I think ageism is at the centre of all of this issue, whether it's the way doctors treat patients, the way lawyers treat clients, the way all of us treat older people, and I happen to be in that class now, so I'm actually got a vested interest and I'll declare it. But I just want to say today, here with us today, are two members from the...
Really close to your mouth.
Here, two members from the Benevolent Society. And the Benevolent Society has initiated a huge project to counteract ageism. They got a Wicking Trust of $1.7 million grant to do that, and their own money. And Robert Tickner, he's here. He and I have, it was like a marriage, signed a pledge to stamp out ageism together, both from the opposite sides of the political fence in Parliament, but united on this issue. And I just want to say all of you should go to the Benevolent Society website and join up the campaign to stamp out ageism.
Keep hold of the mic. I'll just tell our our US friend who's going to give us some commentary on key issues. I just want you to know she's still part of the panel, even though I've got her sitting on the floor. So Kay is a former federal Conservative parliamentarian, and Robert Tickner is a former Labor, what you would call Democrat parliamentarian. Now, I'm just going to whiz over to you for a moment.
We're not Republicans. Let's get it straight. My mother lived in Boise, Idaho.
I was just trying to give her a little bit of a feel for it.
Well, not too much.
Robert, you're involved in every age counts. So what is it?
Well, look, first of all, look, Mum, no hands. Look, it's all good. It's rather intimidating, but...
I know, but it's about volume.
Sure, okay. Well, so I guess my message today would be, first of all, to thank so many speakers who've raised the question of ageism, and Kay really brought it home, but others have raised it. And Margaret, I must say, who I knew in another life, has not lost her passion, and thank heavens for that. Every Age Counts is about coalition, it's about collaboration. It's frankly about all of you in this room. If you go to the website, which is everyagecounts.org.au, just Google Every Age Counts and you'll get it. You'll see the bones of the campaign, the pledge that we're asking people to sign, a video that's narrated by Brian Brown. And really, this is a campaign that seeks to address the fundamental underlying issue that so many of you have identified. And I guess I would say, as someone who's also, like you, a lawyer or a refugee from the law, perhaps like you, that I do believe that law has an important role to play, but it is a very stark example of the fallibility of just relying on the law when you examine the extent of outright discrimination that occurs in this country simply on the basis of age. Kay Patterson and the Human Rights Commission and the Institute of Human Resources have done some fantastic but very revealing and sad research which revealed that something like 30% of Australian employers won't employ someone over 50. Now that's on their own admission. So if you think about that, and you think about the cascading effect of more and more ageist stereotyping that occurs, from 50 onwards, you get the position that we're currently in now, where this pernicious lead foot, this brick that's imposed on people that thwarts empowerment, denies people their basic humanity, is something that will only change if we really get behind this campaign, every one of us. And I just go back to something that Teresa said when she talked about her wish to be regarded as just another person. So we've got to stop people being judged and stereotyped and mistreated on the basis of age. And all of us have got a crucial role to play in that.
And could I just have a comment from you in relation to this health and justice linkage and how that will link to your campaign against ageism?
Well, we think it's very important. We think it's a very significant event that's being held today and the work that's being done on an ongoing basis. Certainly health is one of our priority areas for action, as is aged care, and a number of other areas that you'll see on the website. So, Julie, the point that you've constantly reinforced is this is about collaboration, and whatever you're doing in your own spheres of work, I would plead with you to get behind this campaign. Every age counts, and spread that information throughout all your networks, all your members, your board members, the people that you serve, because unless we start to take a stand against ageism and the stereotyping and mistreatment, it will go on forever and inflict such harm on our fellow human beings.
Thank you very much. Thank you. Yeah, could
And
you give
it's
him a round of applause?
it's a 10
Thank you.
It's a 10 to 15. It's a 10 to 15-year campaign. It's not,
Tip it up like that.
It's a 10 to 15-year campaign. It's no short-term thing. So it's a really very significant campaign, and I credit the Benevolent Society for doing it.
If I could just give a quick example of what ageism is like, I just want to ask Kay something and then I'll come to you. Is when was out with my 94-year-old mother, everyone has been giving me eye contact for the last 10 years, and I have to stare at her because she had capacity to the last minute. She just got frailer and older, and you know what I mean? But eye contact tells you who's got the power. But Kay, look, I just want to ask you something quickly before I come to this question. We spoke briefly on the phone a week or two ago, and one of the things I keep remembering you saying was that many older people, in your experience with the Commission and meeting people across Australia, are very resistant to bringing the law, particularly the criminal law, down on their children's heads, even if they're fully aware that they're being treated badly. And you mentioned that you've seen some work with community policing in Victoria, with mediation through family relationship centres that are trying to empower the older person, but without asking them to, as it were, get the police on their own kids. Can you tell us what you've seen in Victoria with community policing that you think's impressive?
Well, the National Ageing Research Institute did a very in-depth qualitative study with a small group of people, 28, but it was a very in-depth one, of people who'd been abused. And they said, we don't want the courts involved, we don't necessarily need the police involved, but we want recompense, and we want to be the person that's caused this to be treated for their greed or their gambling or their drinking or whatever it is. So when we talk about collaboration, the Eastern Suburbs Community Legal Centre in Victoria, in Box Hill, set up 100 people and part of a network of aged care assessment teams, of community police, of pharmacists, and that has worked so well that the Victorian government has now funded 9 more of those around the state. So when you're working with somebody sees something, they say, oh, I know the community police person because I've met them at the network, and they can use that. And the community police go out. But I did hear one story of a husband and wife, and this is where it's everybody's business. They were English, no children. The wife died. The people over the back decided they'd help the old man in the house, but not only that, they helped themselves to everything he had, his power of attorney and everything. An older woman up the street saw a for sign sale go up, rang the community police, and they got there, but he was dehydrated and starving and died 5 days later in Box Hill Hospital. That is the end of a real awful abuse, but it's about where was the community in keeping an eye on that person? Where was the GP? Where was anybody else? And then I think that's criminal, that behaviour. But the community police will come in and work with somebody to explain to them that they can get help from the community legal centre to change their power of attorney. And I think one of the things we don't do is educate people about what their rights are. They say, I've given my son my power of attorney, as if it's forever. No, you can revoke it. So I think we've got a long way to go with education, of educating people about their rights and educating attorneys about their responsibilities, because I've had a nursing home that said that a mediation centre couldn't go into the nursing home to talk to the older person who'd rung them because the power of attorney, financial, said they couldn't have visitors. That is not on, and we need to educate people in aged care about what the rights, the responsibilities of the power of attorney are, and to educate people about what their residents' rights are.
And just quickly, the Family Relationships Australia mediation, could you just talk to that?
Well, there are 2 groups that, some of you will know this, that Family Mediation Centre Services Australia and also Family Mediation Service, which has now changed its name in Victoria, have been doing trials of mediation, using their skills in family mediation to actually extend it to older people to deal with conflict. And they have been really very successful, and now that funding that was announced on Tuesday, I forget which day I was in Perth, Tuesday, is about some more trials to actually then evaluate those over a 3-year period where people can get assistance and help. Sometimes somebody who's been looking after mum, brothers in America, sisters in Queensland, oh damn, I've been driving mum around, I've been spending all this money, I need to take some money out of her account. Sometimes when they sit down and negotiate, they say, we didn't realise how much mum had deteriorated and how much more you were doing. Yes, of course we can come to an arrangement. So I think those sorts of mediation of minor pilfering, but also of more major things, can actually stop the horse before it bolts out the door. So I think that's another fantastic way of collaboration. But the community police, I'd like to see more in New South Wales, I have to say, and I'd like to see more community police. And they're usually older women who've not transitioning to retirement, who are gentle and who can, people feel trust in them. It's a really good program they're running in Victoria out of the police force.
Now, I'm going to have to manage time, but I've got 2 people with questions. I'm a great believer in audience engagement, and then I'd really like to come to Alison next, if I may, if you want to take the mic. Yes, I'll hold it. Do you want to introduce yourself?
My name's Catherine Henry, and I'm a health and aged care lawyer in private practice here in New South Wales. I completely agree with the need for change in a rights-based approach in aged care, and endorse what you say. But I wonder how on earth we can have any degree of optimism in this country about change when the progressive political parties in this country, both at a state and federal level, are vehemently opposed to human rights reform. In December last year, the man who would be the Federal Attorney General, Mark Dreyfus, argued forcefully against a rights-based charter in Australia, and in New South Wales, the state Labor Party is of the same view, and I'm not a Tory, so I just wonder whether what the panel think about in that, given those problems, and we are way behind other Western democracies in regard to human rights, whether we'd be better to focus on unconscious bias training. We've all seen the introduction. We now have ethics education in our primary schools. You asked the question about what a 12-year-old would make of all of this. Would it not be better to focus our energy on that as a short-term measure?
And do you believe you need a Bill of Rights? Is that what you're essentially arguing?
I certainly do, and I've spoken a lot about this and written a lot about it over 20 years when Kevin Rudd was first elected. He did his national consultation. There was some interest there, and then there have been little blips along the way, but it's certainly off the agenda. The man who would be Prime Minister, the man who is putting himself forward as the alternative Prime Minister, is not interested in a Bill of Rights, in a Charter of Rights.
Thank you. Can I come to Nola Rees just quickly, if you could get the microphone to the other end? We've had reference to a UN action, a Charter of Rights. Just quickly, what are your views?
Yes, I would support a Charter of Rights as well. So I was a lawyer in Canada before I came to Australia and did work in constitutional law. And in Canada, as part of the Constitution, there is a Charter of Rights and Freedoms, and it does make a real difference for people asserting their rights and having that constitutional foundation as the basis for those rights. And yesterday we had a small event on health, justice and ageing in Melbourne yesterday, and there was actually a lot of discussion about the Charter in Victoria, and a sense there was...
Yes, because they have a Charter of Rights and Freedoms, don't they?
That it exists, but it's kind of fallen into the shadows, and one of the participants at the discussion yesterday really emphasised the need to reinvigorate attention to the Charter there and to look at various kinds of policy decisions. It could be urban design within our communities through that Charter lens to make sure that everybody, including older people, are able to participate in all aspects of society.
Could I get a comment from you too? Because I took Catherine, wasn't it, I think? Yes. It was suggesting the education for young people in schools. I mean, it goes to this ageism thing. From my life experience, but also as a period as a community educator in a guardianship context, I think a very significant proportion of the population think that mum or dad's money should come to them before death. I think it's actually a common cultural belief. I hadn't thought of ageism education in a school context, but your thoughts on that?
Yeah, I think that's a great idea too. And in an elder law course I taught here at UTS Law School, one of the first exercises I did with the students was have them complete an ageist perception scale. It was adapted from training for medical and health students, that before they would go into some kind of geriatric placement, to get them to reflect on their own ageist attitudes. So I adapted that for my law students, and it had questions like, do you think it would be more difficult to interview an older client? Do you think that older people take up too many resources in society, that old people are too slow for modern society? And it really made them think about some of these really internalized attitudes they had about older people. So I think that just talking about what ageism is and having people reflect on it is really valuable.
I'm going to take one more audience question, then back to the panel, and then I'll come to you. I'm sorry, I've got to share the time.
Hi. Diana Bernard, Manager of Education and Community Projects at Seniors' Rights. I just wanted to talk to Kay's comments about policing. In New South Wales, there has been a sudden increase in vulnerable persons officers at all the larger police commands. And there's been, before it was quite hard to engage them, and now we've been asked to do a lot of collaborative sessions with them, including vast groups, 70 at a time from some metropolitan commands. And they're really interested in working with us, and we also bring in other partners like the Elder Abuse Helpline. And that's really, the community really responds well to those sort of forums.
So they're called vulnerable...
vulnerable persons officers.
Is that a relatively new thing?
There were some before. There was someone who was trying to develop that throughout police, and there was a bit of resistance, and that seems to have been resolved, and that's now something that's really developing well.
Thank you so much. That's news to me. Hold on, you don't exist unless you're amplified. Thank you.
That's great news, because the tremendous guy who was doing that and was shifted sideways came back. I do keep my eye on what's happening in New South Wales.
But isn't that an example where individuals can make a difference? She knows the guy who's moved. Listen, can I come to Alison? Can you introduce yourself, Alison?
Yeah, I'm Alison Verhoeven. I'm Chief Executive at the Australian Healthcare and Hospitals Association, which is an organisation which represents public hospitals, primary health networks, aged care providers, but largely in the public-funded part of the health system.
Now, look, Alison is full of ideas, but before I get you to list your key thoughts, tell us about your experience with your elderly mother. It's some time ago, but I think it could happen today.
So just before we started this session this afternoon, Julie and I were having a quick chat, a get-to-know-you kind of chat, and I told her a story about my mother, who about 20 years ago, unfortunately, ended up in residential aged care. She was very unwell, she couldn't walk, she had difficulty talking, but she was cognitively quite intact. And she knew that she was continent, but she was unable to walk to a toilet herself. She required assistance. So when she first entered this residential aged care facility, at one point in time she needed to go to the bathroom, and she pressed the buzzer a few times, nobody came. And I happened to be there, so I went to the person in charge. I had no idea what sort of role the person held, but it was somebody official sitting at a desk. And she said, oh no, Mrs. Verhoeven can only go to the bathroom at 8 o'clock, 12 o'clock and 4 o'clock because she's on a regimented toileting schedule, which absolutely enraged me as her daughter. And, I was quite insistent about her needing to be toileted. And, we were told that, no, this wasn't the role of this person. She was actually a registered nurse who had other things to do, and that the care assistants in the home were not available at that time, and my mother would have to wait till the regimented time. So I lodged a complaint in the ACT around that, and then the home actually lodged a counter complaint against me for causing trouble in the home. Anyway, we ended up resolving it satisfactorily, and actually we ended up having quite a positive experience in that home over the remaining life that my mother had there. But I guess what really stood out for me about that, and I often reflect on it when I do my own work, is what's the role of workforce in these sort of situations? What's the role in what role does the funding mechanisms that we apply to different facilities affect that? I mean, clearly there are issues like ageism as well, which are in place, and respect and self-determination. But there's so many systemic issues around workforce, around funding, around governance, which we need to really get to the heart of if we're going to solve those individual anecdotal cases. So I guess that's the point of my story.
So tell me the 2 or 3 systemic changes that could prevent that happening to an elderly person in residential care today.
So one of the things with workforce, and I mean, I imagine this is going to be explored by people like Janet in the future, but also be uncovered in the Royal Aged Care Commission, is, you know, what do we have the right workers in an aged care facility to be able to provide the type of care that is needed in that by that population of that home? And we do know that there's a rapidly changing profile with aged care facilities in Australia. There's really high acute need in many of them now, compared with 20 years ago when my mother was there. There were actually a lot of independent people in those homes, and now it's very, very high acute need just because of the changing funding mechanisms with more packages for ageing, but also the changing funding mechanisms with more independent people remaining in their homes. So as we design funding changes, we have to design changes for workforce. We have to design changes in the way we organise residential aged care so that we can actually provide the care that's needed for those people.
I feel it's such an important story because, you know, the Royal Commission is going to flood the media with really frightening anecdotes. 2, we know there already is a higher rate of suicide and self-harm in older people, particularly older men. So this is a very sensitive time in our national life around these issues, and I think being able to go to the toilet, not soil your pants. I mean, because I am a recent daughter, I can tell Mum was predominantly at home and in aged care for 2.5 weeks. But I had to really work with the staff who cared for her at home to explain they could use as many pads as possible. And they were, because many of them had worked in aged care, they were used to limits on the number, which meant I had a room in my mother's house that was just full of packets of, what do you call them? Help me. Continence pads, because I wanted, and then you have trouble disposing of them all. I mean, that's another story.
And are you allowed to bring them to the facility where the person is actually in care? Because often that's a limitation as well. I think one of the really sad things we do in Australia is we actually spend as little money as possible with the groups that need the most care, and that is really shocking. This is actually often about money and how much we're prepared to pay for aged care, both in the community and in residential aged care.
You also believe it's about clinical governance. What do you mean by that expression, and how would it help people in residential aged care or home-based care?
So people in residential aged care, that's their home, but often because of their particular health needs, their health circumstances, they have a great reliance on healthcare services as well, and including things like getting access to general practice care, getting access to oral health care, to physiotherapy, to palliative care, and also the management of that care and the delivery of that care, which is dependent both on a workforce but also on a safety and quality assurance mechanism. And clinical governance is not well developed in residential aged care.
So what does it mean, clinical governance?
Well, some accountability around risk, some accountability around failure, reporting of error, reporting of incidents clinical incident management, and including having the right staff to manage that, because frankly it's not going to be able to be managed by staff that don't have training to be, for example, registered nurse level training, is a requirement to be able to run a really good clinical governance program. And if you've got very few on your staff and most of your care is being delivered by staff who've got very minimal training, you're very, very unlikely to have a clinical governance framework in place.
You haven't mentioned staff ratios. Obviously, nurses have been very active industrially to achieve that in a hospital setting. What are your thoughts about staff
ratios? Well, I think we have
ratio?
to be more nuanced than just talking about ratios. We actually have to have the right type of staff for the profile of the population of a residential aged care facility. So it's not just about numbers, it's the right type of staff at the right time. Access to oral health care, access to pharmacy, to medicines reviews, so that might be a pharmacist, diversion therapists to actually support an intellectually stimulating environment. So it's not just numbers, it's actually having the right people in the right place.
I'd like to come to Janet Anderson, if I may. Guys, in about 5 minutes, I'm going to ask as many people as possible to tell me the single most important message we should take away from this session, and any recommendations on collaborations that we need to make a difference in the lives of people, either in aged care or at home. Did you want to say something else, Phil?
Before I pass the microphone over, can I just say one thing? We haven't talked at all today about Aboriginal and Torres Strait Islander people and their particular needs in aged care. I don't think we're doing anything near enough to start thinking about what might be suitable for Aboriginal and Torres Strait Islander people. And today, particularly, we should be conscious of it. It's Close the Gap Day today. It's something we should be thinking about.
Could I ask you one more thing before I lose
Sure.
you? In the home-based setting, you talked about the importance of collaboration between primary care, paramedics and the hospital. Could you just speak to that?
Yeah, so there are a number of place-based interventions, if you like, that are starting to really show some legs in Australia and that are really building on collaboration between paramedic services, so ambulance services, residential aged care, hospitals and the primary health networks and the broader primary health care community. They're looking at using good data to identify what we very demeaningly term as frequent flyers in hospital, identifying those individuals that might be regular presenters at hospital and ensuring that rather than being transported simply from their home to a hospital, either residential aged care or from the community, that actually they might have some interventions that are able to take place in their own home, so they're not hospitalised. So a nurse practitioner working with them or others. There's things happening at Brisbane North Primary Health Network with Metro North Health and Hospital Service, likewise on the Sunshine Coast with a number of partners there. I'm aware of a similar really good geriatric program in Canberra that's happening between a number of partners. So those are the sort of things that we should be encouraging, applauding and funding.
Look, thank you. Teresa, I spoke to you at the beginning of the day in order your key messages could come, but in a second I'd like to come to you and say what's the single most important thing that you want these people to take away from this session? What's the thing you most want them to remember? Is that okay? I'll come back to you in a sec. But I'll just come to Janet. Now, Janet Anderson is now the Aged Care Quality and Safety Commissioner for Australia. She's had the job for 9 weeks, so we're going to give her a tiny bit of leeway. But I know you had a couple of issues you wanted to raise, but first of all, from all you've heard so far, what's standing out to you as critical in terms of enabling autonomy for older people in relation to health and justice? What have you gained so far?
Oh, you've started me somewhere I hadn't anticipated. I think you've identified it in the word collaboration. That's the thematic link right the way through the afternoon, quite clearly. I think health-law is too narrow, and I think we've heard lots of examples which have extended beyond that. And I think aged care, which is my new gig, is definitely in the mix. And if I can use that as a segue, we've talked slightly earlier about a charter. Some in the audience would be aware that there is a charter of aged care rights, which is in its final stages of development, which applies to consumers of largely Commonwealth-funded aged care services. It is a rights document in the way that a lawyer would recognise rights, and it will be very significant for my commission in holding providers to account for the services they deliver and the outcomes they achieve for aged care residents or aged care consumers.
And your jurisdiction, just sum up your role, your
sure.
key powers.
The Aged Care Quality and Safety Commission is a regulator, and essentially we hold providers to account for the safety and quality of the care that they provide to aged care consumers. We also require of them that they work very closely with consumers in generating the best possible experiences and outcomes from care. And if I may, there is a new set of quality standards which are being implemented from the 1st of July, which turn on its head the traditional orientation of aged care services. So historically, and I'm talking about some time ago, we're literally years and years, an aged care consumer was regarded as good if they were cooperative, undemanding, and didn't have relatives like Alison. Yeah. That is now fundamentally different. We are now moving into a paradigm shift environment where the new aged care quality standards put the consumer very much at the centre of the picture. And my quality assessors and my complaints officers have squarely in the front of their mind, how was this for the consumer? Did the consumer experience safe quality care? Did the consumer have good outcomes from that care? And if the answer to any of those is no or it's uncertain, then they look far more searchingly at the way in which care has been delivered. And one more sentence, the quality standards require, and going back to that word collaboration, and I'm thinking, what's my thematic link to that? Yeah. The quality standards require that providers engage directly with consumers and their representatives in the design and delivery of care for each individual. Now, you might think, duh, wouldn't you do that? But historically, that hasn't been the case. What has worked best for the provider, and indeed, you could say the same thing about health services historically. Now, where it is a paradigm shift, as I said earlier, the consumer is at the centre, and if it's not working for the consumer, it's not working.
And how will you engage older people? And also, my second question is, who will you be collaborating with to achieve results?
Well, we definitely won't be collaborating with providers because that's regulatory capture. But we will be collaborating with one of the co-conveners of this forum, OPAN, and their sister organisation, COTA. So there are consumer and advocacy representatives who speak with a national voice and who we use as some of our channels to get access to the consumer voice. But essentially, the collaboration I want to highlight is the collaboration we need to see between providers and consumers of care.
And how will you foster that?
Essentially by being a good regulator. We will go to the services and audit their practices, and if they fall short of the standards which require that behaviour, then there will be repercussions.
I made a comment earlier about the kind of my anticipation of fear and anxiety in the community as a result of media coverage of the Royal Commission. Do you think that is an important issue, and does your role have do you have any duties associated with your role to address that anxiety level that's likely to rise in the community?
That's an insightful question. I get asked quite often, is there a crisis in aged care? And my answer is no, there's not a crisis in aged care, but there's a crisis in the community's confidence and trust in aged care. And all of us have some heavy lifting to do to restore that trust. Providers particularly, but also my group as a regulator, and consumers in articulating their interests, their preferences, their concerns, and working closely with providers to ensure that providers understand there's a better way.
Look, I know they're desperate to come in. Let us say two quick things. Tell me about informed consent and what you're hoping to do with that.
Very briefly, there has been a lot of media coverage recently about the overuse of psychotropic medication and particularly antipsychotic medication in older people generally, and particularly in those in residential aged care. we have been doing a lot of work with a range of key stakeholders, and particularly the Commonwealth Department of Health, in looking at the revised protocols which toughen the rules and the protocols which apply to the use of psychotropic medication for older people. Informed consent is at the centre of the picture. Now, lawyers define that in a particular way, doctors define that in a slightly different way, but essentially, is the consumer of the medication aware of the risks and benefits of taking that medication? And if they're not legally competent to reach an informed view about that, who is speaking on their behalf, and are they aware, and have they given their consent? It's an enormously vexed issue, but it is certainly something which has a lively relevance in today's media marketplace.
Guys, I'm going to land the aeroplane in 10 minutes, so if you are able to stay to the end, that will be great. Do you want to introduce yourself?
Hi, it's Carol Ferguson again from Seniors' Rights Service. Look, ageism is obviously important, but the other issue which underpins it in some cases is I'm looking around the room and we're a very white, middle-class group of women generally, and yet the clients that we're serving come from diverse backgrounds. And one of the things about obtaining consent, looking at how systems are going to work, etc., is engaging with, as Ms Geronimo said, the various entities. But it concerns me greatly that we're sitting here and we're all sitting here and thinking, yes, this is fabulous, but we're all white. And I, yes, thank you for bringing in the Aboriginal and Torres Strait Islanders, but, people from a Vietnamese background, people from an Arabic background, etc., are just not representative in this sort of forum. And so my takeaway for everyone here is, to what extent are you actually engaging with the people that you talk about that come from a CALD background?
I'll take that as a comment, a call to collaboration. I'm going to come back to you for comment in a minute, but I'm just going to go to Teresa, if I may. Because I love you, because aren't you the involuntary vocaliser? Yes. Yeah. Yes, dear, you've got a mic. Tell us, what do you want to say? Close to your mouth.
Okay, I have a question for the Quality Commission person. Sorry if I couldn't see
Janet,
you.
yeah.
Janet, hi, lovely to meet you. I wonder, do you have any thoughts on... we have a lot of service organisations that are doing all kinds of things for older people. I don't see any representation of their consumers in their executive or in their organisational structure. And I find that it's in the world of dementia care, I haven't seen any. I wonder, do you have any thoughts on that? Because I'm a bit appalled.
It's an excellent question. And you're right. They're not in my executive structure. We have and are putting in place more mechanisms to hear that voice directly. I think there's an open question in my mind as to whether it is slightly filtered when we talk to the representational and advocacy groups such as Dementia Australia, who does a powerhouse job, but is not you.
Thank you.
Thank you so much. This lady's desperate, so I'm coming to you. Can you introduce yourself?
Sure. Frances Van Zinnen, I'm with Department of Family and Community Services. This question is for Janet. So as I was listening to Alison Verhoeven's comment, I've not had exactly the same issues, but when you said buzzer, those buzzers in aged care centres can go on and on and on for a long time. And I'm wondering how in the capacity of doing an audit as the regulator, how would you catch out that sort of behaviour where those buzzers are unanswered and older people are soiling themselves?
Quick answer. Two parts to the answer. First of all, we have an 1800 number. We take complaints. And we take them from consumers, from consumer reps, from staff members, anonymously, confidentially, in whatever way they come to us. If they're about a Commonwealth-funded aged care provider, and we can identify an infringement of the Charter or the Act, they're ours and we'll sort them. Second avenue, we are looking at care in practice, and we have a consumer experience report as part of our evidence. We are obliged to survey 10% of the residents of each residential aged care facility directly and get their views. You would be surprised how rich that database is and how much information we get from that about the things that give them the pip.
Thank you. Can you stand up? Our friend has come from the United States. It's a very, very long way. She's got a good brain. It was a great presentation. Would you give her another clap? And I've asked her, as an independent outsider, to just give us her thoughts on some of the key issues that have been raised and any observations from her experience that she can offer us. And I'm going to let go of the microphone because it's coming to that time.
Such power. So I think...
Really close to your mouth.
Okay, what I'd like to do is just talk about the theme, which I think runs through all of this, which is really patient-centered or person-centered or client-centered approach, right? Which gets to this issue of sort of silos and egos, which I think was the term that was used by Prue earlier, right? So how do we move towards systems, towards collaborative models that are person-centered and that we're making decisions based on that? One of the things that I think came up that was really important is this idea of working across different cultural groups, and that requires flexibility, again, of thinking about who are we working with. So in the United States, one of our key issues, as you can imagine, are either older adults who themselves are undocumented immigrants, or sometimes they're documented, but their caretakers are not, right? So they're invisible to our systems. And so we have to be flexible in the way that we think about how we reach the people that we're working with. So I think that's about cultural sensitivity. That's about person-centered care. I love the discussion of workforce. I think the whole question, not just of training and how we appropriately address the needs of older adults, whether it's in law or medicine or healthcare across disciplines, but also who are those people in terms of thinking of this question of diversity, right? And somebody raised the question of the people in the room. I think certainly in our systems of care, we need to be thinking about that as well. And then finally, of course, the question of ageism. And I love the human rights framework. We talk a lot about legal rights, but really if we're thinking about person-centered approaches, then we're thinking about dignity and autonomy and focusing on the individual as a person who we should be caring about their wishes, their ability to stay autonomous. So those are sort of my themes, and I think I really thank the panel because I've learned so much about these issues in Australia and sort of how I can learn from all of you as I go back to the United States and think about my continued work there.
Thank you so much. Thank you. Could you give her a round of applause? Just before I ask Tessa to close, because I'm a great believer in finishing on time, so I'm sorry I haven't come back to you more, but is there one message you'd like to give us?
I'd like to say that I love the idea of collaboration, and the intersection between healthcare and the law is a really important one, and those two specialties become closer and closer as a person ages and our requirements change. What I would say as a consumer is you guys seem to be up here. We've got the law, and over here we have healthcare. I'm here, the patient. I don't feel connected. There's services, you guys out here do all this amazing stuff. I have no idea. I have no idea you existed. I don't know how I would ever know that you existed. My daughter didn't know you existed. My husband doesn't. How do you connect? Where do you get your gigs? Who are your customers? Because I'm here and I'd love some help, but I wouldn't know where to begin. So if you could maybe think about those connections as well when you're thinking of cross-collaboration. Think about us down there as well. And that's all.
And look, thank you so much. A round of applause. And if I could speak as a daughter, I'd like to endorse what you said earlier about the desire to have face-to-face contact, because I do think in this digital age, and for a whole lot of reasons, we're being driven towards, people even use the language, drive them to the website. And I think when you're in trouble and vulnerable, as family or a person, you need face-to-face. You go.
Can I just add to that? Self-service for a person with dementia is no service. The internet is not real to me. I don't open my emails anymore. I don't work, so I don't open Outlook every morning. So it's meaningless. So please, if that's all you've got, just don't bother. Save your money. If you can't give me a navigator to show me where this stuff is or look it up for me, just save it. The Knowledge Hub is not for me.
Thank you. I'm just going to hand over to Tessa on behalf of the organisers to close our event.
Thanks, Julie. Communities in control and connectedness, two of the really key messages I've heard this afternoon. I get to do the fun job. Would you please join me in thanking Julie McCrossan, our absolutely stellar facilitator? As the organisers, we wanted to listen as much as get people in the room, and we couldn't have done that without you. So thank you, Julie. Please also join me in thanking again Liz Tobin-Tyler. When Nola Rees said to Health Justice Australia, we might be able to bring Liz Tobin-Tyler, we knew immediately that the Health Justice Partnership Network would want to spend time with Liz. But we also thought it was a really terrific opportunity to start to build the collaborations across the communities and the community organisations particularly that are thinking about working with and responding to many of the same challenges that we've heard about this afternoon. And so in addition to having the opportunity to work with UTS Faculty of Law, we were really delighted to be able to have the chance to work with the Older Persons Advocacy Network to reflect in terms of the work that we do as Backbone or as peak bodies, the kinds of collaborations that we're really trying to foster and encourage on the ground in communities and for services. So my thanks to UTS Law and to OPAN for the opportunity to bring this symposium together. Within those organisations, some phenomenal contributions by our amazing teams. I do want to particularly single out from OPAN, Claire, Tom and Travis, connecting us to the World Wide Web and our comrades on the live stream and making sure many of you are in the room today. And from Health Justice Australia to Miranda Campbell, who has done a phenomenal job bringing everyone in and making sure everyone's been so well looked after. Thank you all. So what's next? Well, you've got a chance to tell us now. As I'm wrapping up, please take the chance to complete the 4 or 5 question survey to let us know what you would like to see next. We will be sending through some communication, key links to resources you've heard about, Liz's report, others that have been mentioned today. We will be providing the webcast that was taken through this session so that you and your colleagues can come back and catch snippets of the discussion again. We will be setting out a communique that has some of the key issues that came up today, and we'll be sending that to you probably in the next couple of weeks. So that's our job. What about you? What are you going to do in terms of taking these conversations back to your communities, to your community organisations? Because this is, for some people, this is the start. For some people, this is the next step in many years of work on these issues. But for all of us, this is the chance to set a community-led agenda that ensures together we are working to support the health, the justice and the dignity of our communities as we age. So we want to stay in touch with you about that. We want to hear from you about what that looks like. And absolutely, we want to find ways to continue to collaborate in that endeavour. Thank you.
Guys, can I just quickly say before we open the doors, I didn't allow time for you to do that survey in the room. I'm sorry about that. But if you could either take a picture of that or write it down, or Miranda, will you be able to circulate it to people by email? So when it comes around, will you please do it? Because this is quite the beginning of something, and your feedback on how to do it better would be good. And the last thing I want to say is there's been a number of law students as volunteers in our room today, and I think that's thrilling. We need to have law students and medical students at all future events. So thank you so much to them, and now thank you and farewell.